Hello everyone, my name is Carlene and I'm going to be talking about performing different types of injections, angles, sites, gauges, what to do, what you should do, what you shouldn't do, all that good stuff. Okay, so it's a lot of information you have to take in. We're going to try to have it sweet and short as possible, straight to the point. Now, I don't know if you know, but they have different types of insulins, different types of medicine. So we're just gonna get right to it. So right here is gonna be my injection pad. This is what I'm gonna be showing you how to drop the medicine and put it in there. Okay, this right here is my insulin needle. I will be showing you how to do insulin. Also, this is an amplitude, which is a glass filled with medicine of insulin or different types. They also have powder, liquid, but this is what I'm going to show you how to do. Now, this right here is a 3 milliliter 23 gauge, which we can basically start talking about it. This is a syringe. Now, right here is the barrel. This right here is the barrel, and it's the plunger. So barrel, the plunger. You want to know your syringes, what it is. That's the syringe. Now that's a syringe with a needle. Now this is the hub right here, and this is the tip of the needle. So this is a hub right here. So I just wanted that. I have my alcohol wipes to clean it and the site, and I have my gloves. So the first thing I'm going to teach you all is a ID in sight, which is a 15 degree angle, which is this, a 15 is this. Now we have 90 and we have 45. Now 90 degree angle usually are used for intramuscular injections, but you also can use a 90 degree of sub-Q injections and 45 degree. So a 90, a 45, and then also our ID would be a 15 degree angle, which you'll be using that. You only use that for either TB or allergy testing. They usually don't use TB, a 15, that for any other thing but that. So right now we're gonna do ID, which is TB. Now I don't have all my things, so we're gonna pretend. We're gonna pretend this is a TB. No, I lie. This, okay. So before we do anything, we will go to our MAR and make sure we have everything we need. When you go to the MAR, you're going to check the 7 rights. I can give you some of the examples, which would be the right patient, the right time, the right dosage, the right documentation. You want to make sure whatever you're doing for that person is that person and only that person. You don't want to give Mike Jordan medicine. You don't want to give Jordan Mike medicine. You don't want to do that because some people are allergic to different things that can hurt them or kill them. So we don't want to make mistakes. That's why we look at the MAR and we check the medicine and everything a lot to make sure. So after that, getting into all of that, an ID is the aspects of the forearm and the upper back. That's what you do your sites for injections for ID. What we're not going to do the upper back, we're going to do the forearm. So we're going to act like this is the forearm for TB. Okay. So with that being said, let's get right to it, right? We might as well get right to it. Okay. I'm sorry, okay. So now we're going to read the medication order, which is the MAR, and you can act like this is it right here. And we're going to just compare what the MAR says to our medicine. Make sure it's the same person. the same dosage, and we're going to check for expiration. Now, there's a lot of things that goes on in nursing that some people make mistakes. Some people forget to throw away or discard medicine that is expired. But we're not going to make that mistake. No, we're not. We're going to check to make sure it's not expired, because anything happens, that comes back on us. We like our money, and we don't, we're protecting ourselves plus the patient. So what we're going to do is we're going to check for the expiration date. And the expiration date is 2024. We are good to go. We ain't got to worry about nothing. So now, since we checked that, we're gonna wash our hands. Now we in the patient room. So now we in the patient room washing our hands, making sure we have everything. You want to make sure you have all your equipment so you don't have to keep going in and out of the patient room. Already, not everybody like needles. Not everybody like needles. So you want to make sure you have everything. It's an unorganized nurse. You don't want to be that. You want to be organized. You want to be confident. When the patients see you confident and organized, they can kind of let some stress go. Now, if they see a nurse that's all over the place, kind of constantly come back in the room, you think I want that person to do anything with me with injections? No. Okay, so since we do that, we're gonna identify the patient. Sometimes medicine get mixed with other people's medicine, so we're gonna identify what the MAR says. So 2 ways we can hurry up and identify: by asking the patient for their first and last name and also their date of birth. Once they give you that, you check in the MAR to make sure that's them. You're going to tell the patient what you're going to do. You're going to tell the patient what you're going to do and how you're going to do it, because there's their right to know what you're going to do to them. So you let the patient know, and then you're going to compare the orders and a bottle of the medicine once again. This is the third time. Third time is a charm. Now, you're going to put on your gloves. Now, we're doing a TB, so after that, we're going to get the patient comfortable. We're going to act like this is the patient. We're going to clean this. We're going to locate the site, and we're going to also clean it. Once we clean it in circular motion, we're going to allow it to dry. Okay. So oh shoot. Okay. I don't know why. Now, before we do anything, I forgot to let y'all know, if this is your first time with this, you'll just use your finger and click it open. But mine somehow broke, and so we have to deal with that. Okay. Now what we're gonna do is we're gonna hook everything up. I'm gonna clean our site, which I told you in circular motion. I want to make all that good. Okay. Now let's say we doing 1 milliliter. So okay, I'm doing 1. Now we're not gonna aspirate this, because if we aspirate, we're gonna be aspirating for blood. So we're gonna get to 1. Okay. So now we're gonna let the patient know what we're about to do. So you ready? Okay. 45. You're gonna bevel up. Okay. We want to taunt. Okay. Slightly use this. Want to recap our needle to make sure. Now, as you can see, I have a weave. Now, if you have that, that's mean you're doing a good job. that means you're doing a good job. That means you did it. It was successful. Now, if you don't have a wheeze, which is just a slight evaluation, you just redo it. So now that we did that, we're not gonna massage it. We're gonna use place a cotton ball to make sure no bleeding. Dispose the needle immediately. We're gonna observe it for 15 minutes. Make sure no allergic thing happened. Document the dosage, site of the placement, and the patient responds. So that's what we did for TB. Okay, so we're gonna do next one's gonna be intramuscular injection, which be allowed in the bloodstreams. For example, if the patient has a throat infection, you would do that or whatever. Is usually we put in the muscle. They have 3 sites. The deltoid with triangle muscular in the upper. That's very easy to abscess. We can use that more often. Also, we have I'm trying to ventral glute. It's used for patients who cannot stand up. Instead, his or her side. This side is not common use. And vastrolaterals, a deltoid muscle that's not well developed in infants or small kids, but it's usually for the side of the thigh. Okay. So with that, it's only 3 sites: the deltoid, which is up here. The ventral glutes, it's like a V right here on your thigh, like the side of your thigh towards your butt, and your thigh for the vastrolateral. For this injection, we're gonna observe the patient rights, like I told you last time. Check for the right of the patient, right time, right dosage, all that good stuff. Read the medication order, make sure nothing expired. If it is, discard it, get something that's not expired. Compare the wash your hands, which we did. Use your gloves. Compare the medication with the container, with the MAR and the container. Also, for the second time, put on gloves. Position your patient. Identify your patient. Let your patient know what you're about to do, and you're gonna locate the appropriate landmark. So we're gonna do deltoid. We're gonna act like we're cleaning the site again. Circular motion, letting it dry. Now we're gonna hold the skin taut, the clean site to put in, and we're gonna release it. Now, this one we're gonna aspirate. We're gonna do one. Okay, I'm gonna put that down there. We go that up. We're gonna do one again. Okay. Now this we're gonna taunt, and this is 90 degrees. So we're gonna do this, and we're gonna use like a dart motion. So we're gonna do that. Get that in there. Okay. Up. Recap your needle. Make sure everything's right. We're gonna check on our patient. We're not gonna leave. We're gonna make sure allergies. Make sure it's no bleeding. Clean it. All that. Dispose the needles in the site. Cover, if we have to, cover it with a Band-Aid or anything. Remove your gloves, wash your hands, and now we're gonna document the dosage, site of the placement, and what the patient responds to it. Now for Z-Track, it's basically, doing that. I don't think we have to do that. Sorry. Now we're gonna do sub Q. Sub Q have a lot of sites. But for you want to rotate your injections. That's just very important. So the patient won't have, you prevent complications like abscess or anything damaging nerves and stuff. You want to rotate your sites, please do. um with sub is so many. um we have your arms, the fatty tissues, your stomach, the bottom of your back, your thighs, your back, and the back of your arms. So that's a lot of sites with that. Which we're gonna do insulin. We're gonna do insulin this time. Now we're gonna do everything that we did for the past 2 injections. We're going to look at the MAR, make sure we have the right patient, the right dose, the right time, the right documentation. We're gonna also check our medicine 3 times again, make sure it's the right patient, identify the patient, let the patient tell you his name and his last name, date of birth, let the patient know what you're gonna do, have all your equipment, check your medicine again, make sure it's not expired, and then now you clean your site. You clean the site, circular motion, my insulin. Okay. Now, let's say we're gonna give 10. Give 10. So you wanna put that back in there. You wanna draw up 10. Every time you do something, you want to change your gloves and wash your hands. I just don't have the time to do all that, but that's what you need to do. So since we did that, we're going to put that down. Now for sub Q, you want to grab the fat. You do not want to let go. Now you can do 45 or you can do 90. We're going to do 45. Yeah, 45. I'm just want to make sure, especially 45. Yeah. Now, before we do this, I just want to let you know about the galls. They have 27, 21, and 18. As you know, the bigger the gall is, the smaller the needle is. So we're gonna grab that and we're gonna 45, hold it, let go. Now we never recap. We're gonna use the finger method, kind of get it. Today is not a good day, but you know what I mean. It's not doing. So needle. Okay. So we did that. I had fun. Did y'all have fun? Okay, so for I just want to make sure I went over everything with y'all. Insulin, when you do insulin, it's 3 different types of insulin for the units. They have the 100 units, they have the 50 units, and they also have the 30 units for insulin. I don't know if I told you that already, but I wanted to let you know. We did talk about the IM injections. I talked about the part of the syringes, the gauze, and the degrees. I talked about that. The length. They have different types of lengths of needles, which is the 3/8, the half, the 1, and 1.5, which is longer. As you can see, I have a picture of it. How long it is. I think that's it. We talked about mostly everything. I did talk about drawing up and opening the AppuTube. I think we did everything. We did everything. Well, if we didn't, we did it now. This was good. Now, for your needles, You don't supposed to do this, but I'm doing it. You want to dispose your needles. You want to check on your patient, make sure if they wasn't allergic to anything. I mean, that is it. We did all that. We did everything. Yeah, we did everything. Oh, we didn't. We did the ampu. The ampu. I'm sorry, y'all. This is a vial. This is a vial. I can't believe I said this was an ampu. I didn't have my coffee today. This is a vial. Now, this is an ampu. Now, this is my only one I have. So I'm not gonna break it, but what you'll do is you will probably get like this, and you would just like, so you won't cut yourself. It's I'm about to say I didn't broke the thing. You would, cut, you will, break it in part to get the medicine out of it. This only holds 1 dose of the medicine. Small, it only holds it. I totally forgot about that, y'all. You take, okay, for instance, let's pretend that we broke this and we took the medicine. We'll do everything we just did. Make sure it's the patient, right dosage, right patient, identify the patient, check the MAR 3 times, make sure that's the right medicine you're giving. Wash your hands, make sure you have all your equipment inside there. And then we'll just do, draw up your medicine. However they tell you how much in the MAR it tells you to give, that's what you give. No little and no more. After you do that, you just, I guess you stick the patient. So we're gonna do sub-Q. I'm sorry, I'm just give me a minute right quick. Let's take a break. Let's give me a minute. I don't want to give y'all the wrong information because I wouldn't want nobody to give me the wrong information. You feel me? So y'all just give me a second to see what the hell. Oh, that's not what I want to say. Okay. Now, some of them have multiple, but that's a valve, multiple use. And when I told you with the multiple use, if someone used it before, you put an alcohol, whatever. Same thing. Get your medicine, stick it, all that good stuff. Well, it can't be no more than 30 minutes. I think I did everything I was supposed to. I'm not redoing this. I'm just letting y'all know I didn't. This is like my 20th video. This is my 20th video. Like literally, like real talk. 20th video. I was.
Oh.
What?
You didn't get your wings.
Y'all didn't get my wings?
We didn't get her Carly wings. Well, a lot of things that was supposed to happen didn't happen.
Right. When I said I didn't order them.
You didn't order them?
No.
Ain't got no wings to get.
I'm sorry. Well, okay. It was nice meeting y'all. Let me know if y'all have any questions.